So today you're going to be looking at chapter 4, which is about communication with adults and children in health and social care. The aims and objectives of today's session are, by the end of the session, you will understand how to communicate with babies, children and young people in health and social care. Now we're going to look at the next few slides and looking about how we do communicate effectively with babies, children and young people. And this is something that you have already looked at. So when you were doing the health and social care and the childcare courses, the big introduction course, it was on unit 4, which covered communication, which was an introduction to communication, looking at barriers and how to effectively communicate. So this is an extension really from that unit as well. So to start off, I want you to think about how do we communicate effectively with babies. So, for a few minutes before we move to the next slide, I want you just to have a think about that. Some of you may have babies of your own, or you've got children of your own who were once babies, to think about how to effectively communicate with babies. And I've sometimes or often heard people say, well, you don't need to communicate with babies. They're babies, they don't speak back. But actually communication, effective communication with babies is a massive part of their development. And, they do communicate back in their own way, whether it be their body language, their eyes, and the communication, they do communicate back using their babbling and gurgling noises. So, there's four things I'm going to run through them with you. So, use age-appropriate language, tone of voice, and facial expressions. So really what I was just saying then, age-appropriate language. So, we do talk to babies differently than we do talk to older children and older adults. We're using that appropriate language and the tone of the voice. We're getting their attention. We use a lot of facial expressions because babies communicate with their eyes. They'll look at you, they'll follow, they'll focus on you, and they want something back. So it's really important that we do look at babies and we do use our facial expressions, and as I said, the tone of voice when we are talking to babies and communicating with babies. Patience and encouragement, encourage the words they know and praise other words will follow in time. So focusing on the words once they start communicating back to you on what they know. I have a granddaughter, which I think I've told you, and she's starting to say some words. She's about 15 months now, and some of the words that she's saying. When we're down at the farm, she knows the word cow. So we really, we focus on that. We ask her when we're down there, the cow, what's the cow? Asking her the questions, what noise does the cow make? She says moo. So she's building up on that knowledge and that communication on what she already knows. Active listening skills and body language, really, really important. Make sure let the children, the babies know that you're interested, giving them lots of eye contact, as we said before, smiles and reassurance, and that. The last one was praise. By praising them, they're going to want to talk more, and by listening and focusing on them. You can use storybooks, pictures, singing songs, everyday experiences, nursery rhymes, lots of ways that we can communicate effectively with babies to help to support their individual development. So the next one, how do we communicate effectively with children? So again, just for a few moments before you move on to the next slide, just have a think again, using your own experiences that you may have. How do we communicate with children? So develop a trusting relationship. Really, really important. If we've not got that relationship, that trust, then they're not going to want to communicate. Some children are really quiet and shy, and if they don't know you very well, so you might be working in a nursery, in a school, and they may have just started, and if they don't know you, it's really important that you build that relationship first of all, and that trusting relationship, so that you can have that communication and it can be effective. Again, the same with the last one, active listening, making sure they know you're interested in what they're saying, using signs, pictures, translators, interpreters, all these things you've looked at when you did look at Unit 4, Unit 4, and some of the other units specifically looked at to support communication. So a good understanding of non-verbal communication, really, really important. And while you're developing that trusting relationship and building that relationship with that child, non-verbal communication, you will pick up, you will find out, you will get to know what even if somebody can't verbally ask you or tell you how they're feeling or ask you a question, you will be able to understand their non-verbal communication, and that might be with using the pictures and the signs and interpreters, but it could be just knowing, that you'll pick up from them this non-verbal communication, and asking open questions, so that leads to a conversation in just instead of just yes and no answers. So asking a child, instead of saying did you have a lovely weekend, and it would be a yes or a no, asking what did you do at the weekend. So then you're opening that question for them to tell you what they did at the weekend, and then that's where your active listening skills, your interest comes in, and then you can build on that conversation. And finally, how do we communicate effectively with teenagers? So again, for a few moments, have a think about this. Those of you who have had experience of having your own teenagers, or you may have teenagers in the family, you may have worked with teenagers before, think about how we can effectively communicate with them. It can be a difficult time in teenagers' lives to actually communicate with adults. So, we need to think of ways to do this effectively. So, avoid patronising. So, it's about, we'll move to the next one, and this will sort of the link really. Establish a bond, rapport, a good rapport with an individual. So if you establish that bond and have a really good relationship with that individual, and avoiding patronising comes into that, because it's about really trying to understand how they're feeling and where they're coming from, trying to get on their wavelength to a degree, understanding, like I said before, it's a difficult time being a teenager, because you're sort of in between being a child and being an adult. So it's about treating them with respect, as with all, but, treat them with respect. Avoid, don't patronise them. Listen to what they're saying. They're learning, and we may have been there. We might think we know better sometimes, but we've got to let them sort of find out things for themselves, without us actually saying, being patronising. Giving praise and reassurance, again, it's another massive part. Communication with all ages, but especially with teenagers, praise them for their actions, talk to them, communicate with them, and again, active listening skills, show that you're interested, because that's really important. If you show you're interested in what they're saying, you're going to build that bond, you're going to build that relationship and that rapport with them, and it all links together. So you'll need to now answer the question in your workbook for chapter 3, and it's asking you to explain ways to communicate with babies, children and young people in health and social care. So use the previous slides to support your answer, my discussions that I've put onto the slides. Make sure you use the sentences in your answer, and you need to include at least one example from babies, children and teenagers in your answer. Remember, it's an explain, so it's an explanation, so you need to give some examples, and always starting your answer with your question, ways that we can communicate with babies, children, young people in health and social care are, so you can use that as a say, make sure you write it in sentences and you give some examples within your answer. And finally, just go over the aims and objectives again. And so now you should understand how to communicate with babies, children and young people in health and social care.